Welcome to another edition of Inside Medicine. I am your host, Doug Geinzer, the CEO of Las Vegas Heals, and we're here in the studio today with CJ Bawden of Hometown Health. For those of you that are new to Inside Medicine, we broadcast right here every Thursday, and we like to bring in the movers, the shakers, the people that are doing amazing things in healthcare, those in the medical education space, those in medical tourism. And today we've got somebody from the carrier side that's bringing a new product right here to Las Vegas to help touch and serve the Medicare community. So we're going to learn a little bit about that. If you are watching this online, you could catch us on Facebook Live, you could catch us on YouTube, and then we rebroadcast out through Apple TV, Roku, all of your traditional stations. And we look forward to having you here every Thursday. So want to get started? CJ, welcome to the studio.
Thank you for having me today. It's a pleasure to be down here in Las Vegas.
Yeah, we like to dive in. We're going to talk a little bit about Hometown Health. But before we get started, I want to make sure that our readers, our viewers, learn a little bit about you. And just to kind of give you a little context of who's watching, Las Vegas Heals is made up of bunch of healthcare providers. So both acute, post-acute, subacute, as well as those in the medical education space, community leaders, and they'll be viewing this, and then it's going to get pushed out through a little newsletter called Heals Headlines. But it's the provider side. So they want to learn a little bit more about Hometown Health, what you're doing in town, what the new product is that you're bringing in, how they may be able to benefit from that. And at the same time, they're consumers. So they may want to learn about how do they get signed up. So let's dive in. Tell us a little bit about yourself.
Absolutely. Again, to all those that are watching, thank you for doing what you do in our community. Being a native Nevadan from Carson City originally, and then transplanted to Reno, and being down here over the past 18 years on and off, I've seen a breadth of what we do here in the state of Nevada on the healthcare side. And it's always wonderful to be able to thank those people that have actually called Nevada their home and come here to help support our care system and our healthcare model that we have here. We're always striving to get out of those bottom numbers in the polls that come out. And I know that we can do that moving forward. But myself, proud husband and father of a little daughter, and we want to make sure that Nevada has the capability to care for those individuals that we have here as we move forward with the growth that we've seen.
Of course, I've got a 9-year-old at home, and I want to make sure that we're seeking and finding care right here in our home state. Absolutely,
especially for the different pediatric models that we have, that we don't have to send our kids over the hill or over to Las Vegas or Los Angeles. When we look at where we're at, even in northern Nevada, there are some cases where families have to up and relocate if somebody gets ill and go over the hill to seek that care that's needed.
And it's great to see you're a Vegas Golden Knights fan.
Absolutely. I had to give up the Avalanche when the Knights came around, but I did at the first shot as soon as we got our own sports team. Being a native of Nevada, and it's been years and years, we've always had to cheer for somebody else. Now when we got our own team, the whole family jumped over and adopted, and we had a great season last year. It's a little rough to start of the season this year, but we got plenty of time to come right back around.
Absolutely. I was born and raised a Pittsburgh Penguin fan. Went to the first game out here and wore my Penguins hat, wore my Vegas Knights shirt, and went in just hoping for a good game. Came out a true Vegas Knights fan. I've lived here longer than there. Homegrown team, and just what they've done to pull this city together after the horrible night of October 1 and that amazing year that we had last year. You can't help but love the Knights.
And really, when you go into T-Mobile Arena and visit a home game, the energy that's here and that Las Vegas displays and the love that they display for that team, it's almost impossible not to get hooked in immediately.
We could sit here and talk Vegas Golden Knights all day, but we're here to talk about Hometown Health. Give us a high-level view. Make sure our viewers and our audience really understand a little bit about Hometown Health, your roots, and go ahead and let's jump in.
Absolutely. When you look at Hometown Health is the insurance arm or the insurance company associated with Renown Health. We are, I'd like to say, a company of onlys. Interestingly enough, we're the only Nevada-based carrier here.
That's awesome.
We're local. We've been in Nevada for 30 years, and we're the only carrier that's locally domiciled in the state of Nevada.
And you guys are nonprofit too, right?
That is correct. We're the only nonprofit here as well in the health insurance industry. So that gives us a little bit of ability to jump back and forth and be a little bit more nimble. When we come through, if our products are performing well and we're making money, we can take those dollars and put them back towards the programs that we offer instead of having to send them out of state to shareholders or send them to individuals that are invested in us.
Music to our ears. It's profits go back into mission, and no money, no mission. So it's in everybody's best interest to help you guys meet your mission.
Absolutely. And the mission of our company is improving the health and well-being of the communities that we serve.
Very in keeping with Las Vegas Hills. We're here to improve the quality of health in Southern Nevada. So we welcome with open arms Hometown Health to this town.
We appreciate that. And then we're also in a transformation. Healthcare insurers and carriers in the past have been on the backside. After you've gone in and received care, after you've done these things, a big surgery or possibly a routine surgery that has to happen, we're on the backside to pay for that care. Now we're stepping forward. Hometown Health is really moving forward and stepping into the health and wellness arena, coming up with new programs and new products. We have healthy tracks. We have gym memberships that associate with our products as well, trying to get on the forefront. If we can keep you healthy, then we're going to improve that healthcare overall and limit the amount of time that you have to spend away from family in a medical situation.
Well, we all too often hear that we don't have a healthcare system. We have a sick care system. And it sounds like you're taking proactive steps to move that to a well care system.
We're really moving forward with that and trying to move that. But as you see, it's a big, heavy pendulum. Yep. And as it swings, we're really trying to get out in front of it. But it's taken years and years. And there's a lot of different things going forward. Different plan designs. You'll hear carriers putting things together, such as credits for wellness and different things. If you go with the wellness program, you do your flu shot every year, you do your blood panels, and you stay on your medications, then maybe they'll knock down deductibles and different things like that. We're really moving forward designs to motivate individuals to improve their own health as well.
Right on. So tell us a little bit about your entry into the Las Vegas market. You're new, but you're really not. You've been around for some time. So tell us a little bit about that background and how Hometown Health came into the Vegas market.
Yes, about 4 years ago to almost 5 years ago, Hometown Health came down and purchased a healthcare network called the One Health Network. And we utilize that network for our clients that are in the area, as well as expanding upon that. With the One Health Network, we have 6 hospitals in the area, a number of urgent cares, and a number of PCPs and specialty providers. We cover the gamut of all individuals. And then we also support our self-insured groups or TPA services. And we support our individual and family that we launched 2 years ago in the Valley, and the small group market that we launched 2 years ago. So this is our second full year on those. And we saw a nice growth in the first year, and we're looking to expand that, being the only true PPO option for individuals here in Southern Nevada.
Yep. That One Health brand, does that continue to live on, or is Hometown Health going to become the dominant that brand?
It'll be our Hometown Health Southern Nevada network.
Okay, awesome.
So we're bringing it in, we're encompassing it, and making sure that individuals know that Hometown is a true statewide product as well.
Yep. And so, do you mind sharing some of the folks that utilize the network and why that's important in Southern Nevada?
Well, the Las Vegas firefighters utilize the network for their products that they have, and they're our largest client down in this area. And then we have multiple small businesses and just over 1,000 individuals in the area that have chosen the Hometown Health product as a PPO option, because most of the products that are down here are an HMO based, and they felt that the PPO option fit them better. And we're actually expanding the care that we can provide on that, especially for emergencies, making sure that people are covered when they travel out of the area.
That's important. That's important. So tell us, we've got this annual notice of change. What does that mean? Well, first off,
so that's jumping right into Medicare. That's kind of a whole different product line. From Hometown Health, we have a product, Senior Care Plus. Senior Care Plus is our Medicare Advantage Plan that we've offered. We've offered for 30 years. And going with that only theme, we are also the oldest Medicare Advantage Plan in the state of Nevada. We beat the competition out by a mere number of months, but we did.
It's all right. It's a first.
30 years ago. It's the first to come to market in this area, back when it was Medicare Plus Choice. So coming into the Medicare marketplace, we're excited to launch a new product for January 1st effective date here in Las Vegas, and that will be our Senior Care Plus Value RX Complete product. When we look at the Medicare enrollment period, they have the annual notice of change. So if you're a member of a Medicare prescription drug plan or a Medicare Advantage plan, every year by September 30th, you're going to receive the annual notice of change.
Okay. So everybody's received it already.
Everybody's received it already. Many people don't open it, as we find every year, because they come asking questions. Well, what happened here? What happened here? Because Medicare is passive enrollment, if you don't change your enrollment during the annual enrollment period, then you're going to be automatically pushed back into the same plan that you have.
Got it.
It's a convenience factor, but many things can change. And if you don't look at that document, the ANOC or annual notice of change, you won't know what's changed with your plan.
Got it.
Typically, every year, something changes, whether it be the prescription donut hole, where that is starting to shrink over time, or whether it be your carrier went with a new provider panel. Maybe your provider left that panel, or if they've changed the benefits, changed co-payments on some benefits, or changed drugs from tier to tier. Those are all outlined in the annual notice of change. Anything that's changed with your plan, you'll be able to see in that document, and you'll know if you have to look for a new plan, or if you're happy with those changes, you'll be able to roll right back into that plan for the following year.
And so they're going to be able to see new plan in town. They're going to be able to see that the Medicare Advantage Plan, Senior Care Plus, is here. What is it that you offer that the others don't? What makes it that enticing?
Well, when you look at Senior Care Plus, we come into the market with a customer-centric plan. We're also, as I said, domiciled here in the state of Nevada. That doesn't mean that we're just here. That means that all of our operations are here. So if you join Senior Care Plus and you want to talk to somebody in customer service, you're going to talk to a person in our Las Vegas office.
Awesome.
We also offer areas where you can come right in and talk to an individual. If you don't want to talk over the phone, if you have an issue or claim that you want to go over with and find out the payment benefits or why something didn't happen that you thought should happen, you can come in and talk to a person face to face. You don't have to talk to a phone center that could be located in another state. Everything that we do is located right here. The other thing is we're the Medicare plan with heart. We really look at with the growth. It started out, our now Chief Operations Officer started with the Senior Care Plus product when it had 2,000, 5,000 individuals. Now that we're over 20,000 individuals in Northern Nevada, looking to add a very healthy population here in Las Vegas and Pahrump as well, that we know a lot of our members. On a year after year basis, after being that face-to-face contact with them, you get to know the individuals that are on your plan. And we really want to make sure that our individuals have the best care and the best experience they can have, both from the payer side and then from the medical care side that they have.
Yep. So I probably need to better understand this. And I just went to the Southern Nevada Healthcare Forum the other day. It was on, I believe, Monday or Tuesday this week. And I'm still a little bit challenged, as I'm sure a lot of folks are out there. The difference between a traditional Medicare plan and Medicare Advantage plan. Give us the Cliff Note version, the third grade version for me.
Right. So there's Medicare, Medicare, Medicare. Everybody hears all these different terms. The important thing to note is a Medicare Advantage plan covers everything that original Medicare covers. Typically, Medicare Advantage plans offer more. They offer dental services, gym memberships, health and wellness services, vision coverage, dental coverage, and hearing aid coverage, those types of things. Many of them offer more benefits, such as Senior Care Plus. We offer transportation benefits for our members. So if they can't drive, we offer transportation to and from doctor's appointments, to hospital stays, things like that. And then prescription drug coverage as well. Original Medicare, you have to go out and buy a prescription drug plan to go along with your original Medicare coverage. Medicare Advantage is a Part C, and it wraps Parts A, B, and D.
This is the part that always confuses me.
So what it is it really gives you a complete care coverage in one place for one price, and you're dealing with one private company that's contracted with Medicare to take care of your needs and your Medicare benefits all in one spot.
So it's nice because as we age, we may not be as coherent, and to have one plan rather than these multiples, it's easier for somebody to manage the plan. Is that a right assumption?
Absolutely. When instead of calling 2 numbers or 3 numbers to talk to different plans and make sure that your benefits are coordinated, you've got one place to call, one person to talk to that can make sure that you get everything that you need in one spot. There are many, many Medicare Advantage plans in the area. What kind of makes us stand out a little from those other plans is that we're an HMO plan, but we don't require authorizations for an individual to go see their specialist. When we look at the primary care and specialist relationship, we know that individuals need to see specialists, and as long as they're within network, they don't need that prior authorization.
That
they can
helps.
move forward directly.
We've so many times talked about, you brought it up, Nevada may not have the best quality outcomes. It's what we're dealt with. We're trying to fix all that. Everybody is. And if you break quality down, we always look and we go, it's really as simple as reducing the time from diagnosis to treatment. If you could reduce that, and many times it's that referral process because it takes so long. So by breaking that down, that's probably the biggest barrier, in my personal opinion, to be able to get somebody with the right provider at the right time for the right treatment.
Absolutely. That is a big barrier, and we wanted to remove that barrier so that individuals can get in and see a specialist. Of course, if the specialist looks at the individual and says, well, you really don't need to see me, this can be taken care of through your primary care, then they can go right back and make sure that they have a good relationship with the primary care. That really brings me into the core of why Senior Care Plus is here in Southern Nevada today. We, in the North, we have our own hospitals, our own med groups. We have all of that in place. We've had for a number of years, and we have a strong relationship there. We can provide a very good care model. It's fully integrated. To come to a new marketplace like Las Vegas, which is completely different from Northern Nevada, we understand that. We understand there's different care needs. There's different delivery methods for healthcare. We partnered with an organization called P3 Medical Group. P3 Medical Group has different primary care and specialty practices throughout the Las Vegas Valley, and they're really patient-centered care. It was very important for us to find a partner that looked at our beneficiaries and our members the same way that we do and make sure they have the best care possible. And P3 was the organization that we found most closely aligned with our values and the passion for caring for those individuals to make sure they'll actually spend the time when you go into your primary care visit to make sure that they answer all of your questions. It's not a rush in, a rush out. As we understand, and to no fault of the providers whatsoever, the care model has changed, and you have to see a lot of individuals to make sure that you can get the workload and the pace that's required to see all the individuals that need to see you. So looking at that, we were able to find a group that has capacity and the dedication to see our members and go from step 1 to step 100 all in one visit.
P3 is a strong supporter of Las Vegas Heals, and it's been fun to watch these guys re-enter the marketplace again because we all know Drs. Abdu and Bacchus, and it's just they enter the market strong. And we've been watching their growth with their new centers opening up. I think they've opened up 5. They've got 3 more slotted to open up, and to watch their progress, their growth, their expansion, and now this partnership with you. It's big. You know who benefits? The community. The community benefits, and that's what we're trying to do is improve the overall quality of health. And I think that's by expanding access, and you guys, that partnership's allowing that to happen.
Definitely. And it really, like we talked about, we wouldn't be down here unless we had somebody that we knew that we could count on to provide the top level care that we need and to make sure that our members have the best health outcomes they can. The P3 has a dedicated history of making better outcomes for individuals and making sure that they are on the correct treatment plans or preventive plans to increase their health and well-being and make sure they live a quality life going forward.
So we've covered quite a bit of turf here. There's probably something that we didn't touch on that you want to. What would that be?
I guess the biggest thing to touch on is we're very excited to be down here in the marketplace and make a difference in our area. We have an office right off of 215 and West Sunset. And this year we're going to be rolling out our new Value RX Complete plan. And with that plan, we want members to know that it The benefits are very competitive. When you look at the Medicare Plan Finder, it's a federal government website that ranks, directly from the Centers for Medicare and Medicaid Services, and it ranks health plans in the order of lowest out-of-pocket cost to the consumer. We're very happy to see that we showed up number one on that in this area. So we have a plan that offers individuals a dedicated personalized PCP and care service model, as well as an extensive specialist that you don't need a referral to go and see those specialists, and then a great hospital coverage with UMC and their quick care centers as well.
Yep.
So we have a great product that we think is going to be a great alternative for individuals that are maybe looking for something else or an alternative to what's readily available here.
Great access points. So with that being said, if our audience, our viewers want to get in touch with you or learn more about Hometown Health, where do they go?
The best place to go to is our website, seniorcareplus.com. Individuals can access all the information, look at the plans. It's kind of an easy portal setup. They can also call our customer service line. We have a dedicated number here in Las Vegas, and then dedicated numbers up to Northern Nevada. I'll give you the Northern Nevada because I don't have the Las Vegas number memorized yet, but it's 775-982-3112. And we have a dedicated line down here, a 702 number as well. But please feel free to look at the website. All of our information's on there, and you can go through email our customer service or ask any questions that you need.
Very good. CJ, thank you for being on the show today. For our viewers out there, we look forward to seeing you next week on the next edition of Inside Medicine.